Hey friends, Cathy here. This is the first tip in my email series about vagus nerve exercises to stimulate the vagus nerve and help to strengthen your vagal tone. So if you've missed the email where I started talking about this, please go take a look back because it'll explain why the vagus nerve is important, the role that it plays in your physical, mental, emotional well-being, and the fact that we actually have a lot of control over toning this nerve that affects all of our bodily systems. And these little bitty investments we make in doing these simple exercises, sprinkling them in throughout our week, is a huge investment in our health and well-being for the rest of our lives. So let's jump in. This first one, we're going to do a baseline first. After you've learned how to do this, it's great to do it lying down on the floor because you're even more relaxed, but I'm going to do it sitting up so that I can demonstrate it for you easily. So to get our baseline, let's first take one deep breath so we can kind of settle in to begin. Close your eyes if you like, settle the hands in the lap. As you breathe in, fill up the upper chest, then the middle of the lungs, and then the belly. So you're bringing the oxygen all the way deep down into the lungs, filling them up. And then we're going to slowly let that exhale just naturally follow. Let's do it one more time. Chest rises as it fills, middle section of the lungs fills, belly fills. And as we slowly exhale, we're going to draw the navel in just slightly, feeling all the air leave the belly, leave the middle of the lungs. Finally, the chest relaxes down. Let's go ahead and open the eyes now. We're going to, get our baseline first. So chin comes over the right shoulder. Just notice where you have to stop because whatever tension we're holding here in the shoulders is going to prevent us from going to any further. And then also, obviously, the mobility of the neck to begin with. But just notice how it feels here and how much mobility it feels like you have. Bring the gaze back to center. Let's go over to the left. Now, notice if one side is different than the other. I never have as much mobility in my left side because I always carry a little more tension there. So I have to stop a little earlier in the movement. My chin doesn't come as far over toward the shoulder as it does on the right. That left side, I can just feel there's a lot of tightness there preventing me from going further. So even if you can move about the same distance, you'll probably notice one side has a little more tightness than the other. So now we're going to interlace the fingers. We're going to leave the thumbs free, and we're going to bring the outer edges of the hands, this outside edge, is going to rest right at our hairline, and we'll leave these free thumbs to just gently rest down into those muscles. So we're not going to actively press, but you can feel there's a little pressure there. And then go ahead and open the elbows as wide as you can. I'm going to take the gaze over toward the right. So either at that 2 o'clock position or that 3 o'clock position. And we want to try to keep the nose facing forward. So I have a hard time keeping my nose forward and keeping my gaze over to the right. But just be conscious of that's what our goal is. And notice if you feel any stretching around the eye sockets. We want to stay here for about 30 seconds. And just keep that deep and steady breath going. And also notice any other sensations that you feel in the muscles of the shoulders or the neck. And keep in mind, if this ever becomes painful, then you just immediately stop and rest. You might try coming back into it, or it just might not be working for your body today. If the shoulders don't want to be this open, if you have an injury or something, this just might not work for you today, and that's okay. So let's go ahead now and bring the gaze forward, and then we're going to take the gaze over toward the left. So again, keeping the nose forward, we'll take the gaze up around that 10 o'clock spot or maybe down toward the 9 o'clock spot. You decide what feels best for your body. We don't want to be overdoing it. So if you feel a huge stretch around the eyes, then take it back just a step. We're not trying to do a big old eye exercise here. We're just trying to stimulate the vagus nerve. And if you feel the urge to swallow or to yawn, that is a really good indication that your vagus nerve is feeling this stimulation. That is a very typical response. So we'll keep that gaze over here for a few more seconds. And again, deep and steady breathing. We want to keep that steady breath and just notice as you press down into the shoulders with the thumbs. You're probably going to feel one side is a little more tense than the other. Let's bring the gaze back to center. Go ahead and release the hands. And now we're going to retest. So take the chin over toward that right side. See how that feels. And then back to center, and then slowly over toward the left. And notice, do you have a little more mobility on the side where if you were experiencing some tightness, do you? I definitely can go a little further this time. I just don't have, I have more mobility here now. That exercise took us, 2 to 3 minutes? That is how short most of these exercises I'm going to be sharing with you are. 2 to 3 minutes investment of your time each day, sprinkled different ones throughout the week. This is a huge investment in maintaining homeostasis or balance or equilibrium within all these vital systems of your body, for your heart, your lungs, your digestive system, your liver. These are hugely important systems for your body, and this vagus nerve, keeping it toned, will help it to support balance and optimal function of all those systems throughout your life. So you're making this tiny little 2 to 3 minute investment each day to help regulate your nervous system and your bodily function for the rest of your life. Think of it as a tiny little deposit in your health and wellness bank. And I will see you with the next tip next week.